instrument, that's a cotton plier, and there's another. Look at the corrosion. Spoon excavator, work it out, get a little purchase on it, and grab it. Again, sometimes they break. So I always warn my patients ahead of time, with silver point removal, it's somewhat unpredictable. You may have to leave a segment in. And even if you have to do that, there is validation to cleansing the parts of the canal that you have access to. And sometimes changing that environment, even without the ideal result not being reached, you can reverse disease by removing the bacteria. So buck one again, we had a little bit more of a pesky one that didn't want to come out. So this is again similar to how I would approach post-removal or separated instrument. I'm just going to try to relieve it coronally here and see if that doesn't start to vibrate out, similar to what we showed you on the post. And again, it's a very powerful instrument, and you'll see it'll start to vibrate the silver point right there. And once this is out, then at that point, we're moving on to a whole other phase of the treatment. This is obviously going to be the rate-limiting step of the procedure, because we just don't know how long it's going to take. We don't know if we're going to actually get them all out. In this case, fortunately, we were able to. And almost. Silver points are removed. Patience, work gently with them. You can't force it. You can't overzealously vibrate them. You just have to work with them at a very measured pace. Okay, so now we're going to do obviously thorough irrigation. And now we're going to start our instrumentation. We know that it was silver point obturated, so we're not going to have a tremendous amount of gutta percha to work with. So now we have to instrument these canals thoroughly and then focus our attention on irrigation. So I'm going to use, again, a CS is that carbon steel file, that C file. And we'll lay that right down and just to an estimated working length, try to establish a nice glide path. So now we're starting to use this approach on this retreatment lecture. This is my approach toward root canal treatment and how I treat these cases. We're going to use our K3 shaper files to open the orifice of each canal. First will be a 25 at the tip with an 08 taper. It's going to give us a nice shape. It's going to really penetrate and start to get rid of all that disease dentin, all the bacteria that have cultivated in there in the dental tubules. You'll see all the debris that comes out. Wonderful instrument to open the orifice. Okay, start to see that we're starting to really get some nice shaping here. I don't show irrigation over every step, but I do it, but for video purposes, we want to just kind of move forward. Here's a 25.12 taper, wide taper. This is going to really open that very coronal orifice for me. Really get that debris out of there. And also allow lots of flooding of the irrigant. That's what coronal opening and really coronal shaping does. Very quickly, you're able to really flood that canal with irrigant, whereas before you wouldn't have that opportunity. Okay, always air, water, remove debris. Now 25 at the tip, 0.10 taper. I did 08, I did 12, and now I'm going to just smooth it all out with a 10. And we're going to have a real nice coronal shape to deal with. You start to see the shape inside. You'll see that as we dry. And again, you see how the dentin comes up in ribbons almost. You're really cutting the dentin. The dentin in the coronal third is safe to remove. You have a bulk zone of dentin at the line angles. You want to get that out of there. It's just interference to your rotary instruments. Rotary instruments are meant to cut in the canal in the middle and apical third, not in the coronal third. So we'll dry, we can see how nice and open that's getting. Lots of irrigant in there, which is just what we want. So once I get to this stage, I've removed the silver points, I've already got a lot of irrigant in place, I've removed a lot of disease dentin, and now we're going to measure for working length. Apex locator, just to demonstrate that that's what we did next. And then as I mentioned before, the next step for me is always going to be I will open the canals to a size 25 hand file. Other practitioners, other lecturers may tell you a 15 or a 20. Everyone has their preference. What's nice about a 25 is the endodontic literature shows you that the minimal or average diameter of an apical foramen is 0.25 millimeters. That's what the classic studies show. So at the minimum, if you can get it open to a 25 at this stage, then you really have done your most minimal cleaning. If something were to go terribly wrong, such as an instrument separation or something of the sort, you would already have done some pretty effective, at least minimal basic cleaning here. This is also a wonderful place to stop. You have removed your silver point, you've irrigated it, you've opened to a 25, you can dress this with medicine and kind of go from there. So again, my twisted file technique is going to be, now that we have everything open to a 25, the first instrument will be a 25.08, and we're actually going to carry this right to working length. Totally different technique than what was described earlier and what classically we all know, which is that you pump the rotary instruments in and out. The twisted file is using a smooth in and out motion, and you move on to the next file. It's very, very different, but it's very, very effective. So once you establish that, you have a 25 at the apical, 08 taper. All the rest of the instruments are simply going to cut apically and apically enlarge. So here's the next step. We're going to carry it right through. So 25.08. I'm going to go in and out. Done. 25.08. Wipe the flutes. Always clean flutes when you introduce them into the canals. They're meant to cut with clean flutes. In and out. Simple in and out motion. No pumping. They're not meant to be worked that way. In and out. Move on to the next file. And in this case, because that's a 25.08, it's simply going to be apical enlargement. The next file we're going to introduce is a 30. This is going to have an 06 taper. So really, when you think about an 08 versus an 06 taper, the only area it's going to cut is going to be apically. And because of this, you're able to really enlarge apically. Because of the flexibility and the strength of the instrument, you're able to really capture just natural canal anatomy and not disrupt that. So you get lots of waves and curves that we weren't seeing before. In, working length, out. And we can see how it removes debris. We'll carry this through. Always irrigating, but I don't want to show it on every single sequence. 35 now. Start at 25.08, 30.06, 35.06. At any point here, you can stop. No one's saying you have to take it up to a size 50. In this case, I was able to quite easily. But anything above a 25 is considered acceptable. You have to gauge it on your own confidence level and really based on the canal anatomy to begin with. But if you're able to open them larger in a safe way, again, when we talk about those apical deltas and all the anatomy that we described earlier, this is what allows you to open those little ramifications, open those little deltas, and get your irrigant to flow in there. So now we're at 40. Now this is 04. So we went 08 on the 25, 06, 30, 35, and now we're 04 for 40 and 50. So again, an 04 tapered instrument, which has already been prepared, which is in a canal that's already been prepared to 08 taper, is simply going to go to the apex and enlarge. And then the final file. And never before have I ever been able to open lower molar mesial roots to a size 50. And that would make Dr. Trope and the contingent down at University of North Carolina, who have always advocated opening canals larger, very happy. And you can see it, same motion every time, in and out. And we're done. We've removed the silver points. We've removed any gutta percha. We have irrigated. And we have fully instrumented all three canals to a size 50.04. Now I'm going to go with my irrisator. This is going to allow me to now that I've opened the spaces, especially apically, all the deltas, all the ramifications. Now I'm going to use that passive ultrasonic irrigation. Bounce it off the walls. Try to get it into the tubules. Try and get those ethate callus, right? Try and get the biofilm disrupted. Try to remove our #1 enemy. bacteria. You can see how it bubbles. You can see the activity. Wonderful instrument. It's my newest addition. Learned it, I was eating dinner with a colleague. He pulled out a pen on a cloth, it was a paper tablecloth, and described to me how excellent this was. Now, anytime you're going to use chlorhexidine, and of course we're using sodium hypochlorite, for whatever reason there's a chemical reaction between the two. You have to clear one before the other. So I use an anesthetic carpet. One full carpet, rinse out the hypochlorite, and then now I'm going to irrigate with my chlorhexidine 2%. And then what am I going to do? Irrisafe. Irrigation is it right now. We have lots of different ways to instrument. I think this is the best way to this point, based on my own personal results and feel. And my partner, who is in his late 50s, who never switched anything, and he loves these instruments also. And we're having just greater success with them, being able to open canals larger, being able to maintain canal anatomy. And again, this is our chlorhexidine. We'll dry it. And I'm going to move on. So this is now going to be second treatment visit. We're almost done. Irrigation and obturation. Okay? Access has already been opened. We're starting to irrigate. Came in. Calcium hydroxide is pure white. Beautiful. So happy. Happy for this patient. Gutta percha points are fitted. The gutta percha will be the exact same size, okay, as the last file that we used. Fit them in. We'll get a master cone film. I typically don't take a working length film. I think it's important to take one. If you're not as experienced with the apex locator, we can see we have a nice fit here of all the cones. You're always going to see, especially in silver point cases, sometimes residual debris. And now we're going to obturate. So first, a little more irrigation. We'll go sodium hypochlorite along with the smear clear. Smear clear is 70% EDTA. It's a chelator. It's going to help, again, remove the smear layer. Again, my Irrisafe tip. You see the trend here. Always trying to irrigate better. Always trying to push that irrigant where it needs to be.
You have 5 minutes.
Yes, it's going to be perfect. Okay, so again, we're going to use the carpule of anesthetic. And again, this is just to build up, to prevent the buildup of the chlorhexidine and the sodium hypochlorite precipitate that forms. I'll just kind of skip ahead just a little bit here. Irrigate again. Chlorhexidine. Dry it nicely. And now let me show you the warm vertical technique. I'm using gutta percha and the classic Roth sealer. And we're going to use the Elements Obturation Unit, which is a System B, and then a backfill device. The cone is placed in the canal with the sealer. The System B is used to downpack the cone. And we'll follow it up with a hand plugger to just get a nice vertical compaction. So what I'm doing here is gutta percha is my vehicle to deliver the sealer into all those little irregularities that we've been talking about. So by using the warm pressure, you saw the System B tip come in, warm pressure, and now I've got a little apical plug there, and by compressing that, now I squidgy all of that sealer into all the tubules. At least theoretically, that's what we're trying to do. I'm going to use a plugger. Here's another cone. Again, the sealer in place. System B tip. Warm vertical pressure. Thermoplasticizing, softening that gutta percha so that we can compress it. Because we've prepared it well and have a cone that fits so well, we can put a little pressure on there. And instead of seeing the gutta percha go through, we see the sealer move laterally. Compress it with a little instrument again. One last time. See quite a bit of sealer there. System B. Heat. Down. Guideline 5 millimeters from your working length. Use your own best judgment on that. Compress it. And then we'll backfill as the last step. So you can see a nice gutta percha there. Such a nice feeling. You start out with this dirty, contaminated silver point and debris. And then when you're done, you see this orange shiny